Hello, my name is Erica Silver. I'm a genetic counselor and the breast health specialist with the UCLA Athena Breast Health Network. This module is going to discuss breast cancer risk assessment. We will cover what risk is, how breast cancer risk is determined, and what that information means for you. Risk is simply the chance an event can happen. The graphic on the left shows the lifetime risk for both men and women to die due to a particular event. The larger the boxes, the higher the risk for death by that incident. This arrow shows the lifetime risk that a woman will die from breast cancer. As you can see, it is in between the risk to die from a stroke and to die in a car accident. Every woman is at risk to develop breast cancer in her lifetime. That risk is approximately 1 in 8, or about 12%. The average age to develop breast cancer is approximately 61, with the most diagnoses happening after the age of 50. If healthcare providers can identify women who have an above-average breast cancer risk, there is an opportunity for earlier interventions. These include screening, detection, and/or risk reduction and prevention. There are a number of factors that can influence a woman's risk to develop breast cancer. We have them grouped into 4 main categories. Personal risk factors include being female, age, and any breast biopsies with atypical ductal hyperplasia or lobular carcinoma in situ, or LCIS. A woman's reproductive history is also an important factor. We take into account age at first period, age at menopause, age at first live birth, if a woman has had any live births, and history of hormone replacement therapy. Family history has a strong influence on a person's risk. This includes the extent of family cancer history and a person's genetic status. Lifestyle factors, including lack of exercise and dietary factors, can also influence risk. All these factors are taken into account when healthcare providers determine a woman's lifetime breast cancer risk. Genetic counseling is relatively new in the healthcare field. One of the main roles of a genetic counselor is to calculate and communicate risk to patients. During a cancer genetic counseling session, the cancer genetic counselor will gather information about your medical history, as well as ask you about your family history. The genetic counselor will interpret that information to see if there are any factors that could contribute to an increased breast cancer risk. The conversation will then move to educating you about breast cancer risk and potential options available to manage or reduce that risk. Overall, the counseling session is a dynamic conversation where you will have the opportunity to ask questions and discuss any concerns you may have. One model that healthcare providers use to determine breast cancer risk is called the Gail model. There are 5 main categories this model takes into account: the woman's age, race, reproductive history, including age at first period, age at first live birth, and age of menopause, breast health history, including number of breast biopsies and number that were atypical, and breast cancer history in her mother and sisters. Healthcare providers plug this information into the model and it generates a risk percentage. A 5-year and lifetime risk for breast cancer is calculated. This model considers a woman with a 5-year risk greater than 1.67% to be at elevated risk and warrants follow-up. There are also certain factors the model does not include, which can be seen on the right. That is why it is important to see an appropriate healthcare provider to discuss this information, because the risk percentage from this model may not be accurate. One example of this is if there are cancer diagnoses from your father's side of the family. This model does not take into account that information. If this is the case, other models can be used to determine a woman's risk. This is an example of a woman's breast cancer risk using the Gail model. Jennifer is 39 years old. She had her first period at age 15, has not had any live births, and has not gone through menopause. She has not had any breast biopsies and has one mother or sister with breast cancer. On the right, you can see her risk has been calculated in 10-year increments, keeping in mind we now calculate a 5-year risk. By age 49, her breast cancer risk is approximately 3%. By age 59, her breast cancer risk is approximately 7%, and by age 69, her risk is 11%. Using this method, Jennifer would be considered at above average risk because her 10-year risk is above the cutoff of 1.67%. The pie chart here shows the distribution of all breast cancer diagnoses. The blue section contains sporadic breast cancer. It is the largest section of the pie because most breast cancer diagnoses are sporadic and happen by chance. This risk is equivalent to the general population risk of 12%. The red section contains those diagnoses that are considered familial breast cancer. These diagnoses are due to a combination of factors that, when put together, increase the risk for breast cancer in that family. The smallest piece of the pie contains those individuals that have a hereditary cancer diagnosis. These individuals have a gene mutation that is passed from family member to family member. This gene mutation significantly increases the risk for breast cancer. The most common genes to increase the risk for breast cancer are BRCA1 and BRCA2. The graphic you see here is what genetic counselors call a pedigree, which is just a picture of a family tree. The circles you see represent female family members, and the squares are male family members. The lines show the relationship the family members have to each other. Family members with a black dot have had a cancer diagnosis, and the arrow at the bottom would represent the patient bringing their family to the attention of the healthcare provider. In this family, we have the patient's mother with breast cancer at age 72 and the patient's paternal grandmother with breast cancer at age 80. This represents cases of sporadic breast cancer. There are no specific pattern of cancer seen in the same bloodline. There are few family members with cancer, and those who have had a diagnosis were at ages consistent with the average. The pedigree that depicts a familial cancer family is seen here. The arrow points to the patient who has a sister with breast cancer at age 67, a maternal first cousin with breast cancer at age 55, and the maternal grandmother with breast cancer at age 74. This family has a weak cancer pattern, with cancer skipping generations. The cancer diagnoses are also consistent with the averages. Hereditary cancer families have a strong cancer pattern as seen in this pedigree. The patient has two sisters with cancer, one sister with ovary cancer at age 52, and the other sister with bilateral breast cancer at ages 39 and 41. The patient's father had breast cancer at age 57 and paternal grandmother with breast cancer at age 69. There are family members affected throughout multiple generations, with some of the cancers occurring at younger ages. There are family members with more than one cancer, like cancer in both breasts, known as bilateral breast cancer, and individuals with rarer cancers, like ovary cancer. In these families, a gene mutation is passed through family members and increases the risk for specific cancers, like breast and ovary. It is important to remember that all cancer is genetic because it is caused by changes to the genetic makeup of the cells in the body. The difference between hereditary and non-hereditary cancer is seen in this slide. The picture on the left shows the progression of normal cells to cancer cells in the non-hereditary pathway. This person starts with normal cells, and because of a combination of factors, the cells acquire mutations until the cell no longer functions properly and becomes cancerous. This is the same pathway in hereditary cancers, but these individuals are born with the first mutation. This is shown in the graphic on the right. With the first mutation, these individuals progress faster to cancer. That is why the hereditary families typically have an earlier age of diagnosis. Family history has a strong influence on a person's risk to develop breast cancer. The graph here shows how a person's family history can influence the cancer risk. The bar on the far left shows the general population risk of 12%. The stronger the family history, the more the risk increases. The bar on the far right shows the family history component that carries the greatest cancer risk, the BRCA1 and BRCA2 genes. Individuals who carry one of these gene mutations have a 56 to 85% chance of developing breast cancer in their lifetime. There are common myths about the impact of family history on a person's cancer risk. We want you to have the most accurate information to bring to the attention of your healthcare provider. On the left, you will see the 3 most common myths genetic counselors discuss with their patients. The first myth states that cancer history on the father's side of the family does not influence a person's cancer risk. In fact, 1/2 of all hereditary cancer patients inherited it from their father's side. That is why it is important to inform your healthcare provider about the cancer history from both sides of your family. Both sides of the family are incorporated into a person's overall risk for breast cancer. The second myth is that ovarian cancer in a person's family is not related to their breast cancer risk. Ovarian cancer is an important indicator when determining a person's risk to develop breast cancer. It is important to note, however, that ovary cancer may not always be present for a person to be at an increased risk. The last myth says that the most important family history factor for a person's risk is the number of affected family members. While it is important to know the number of affected and unaffected relatives in your family, the most important indicator is the age of onset. Hereditary cancer families tend to have cancer diagnosed at younger ages. After all of this information, you may be wondering what your next step is. If you feel you may be at an increased risk for breast cancer due to the factors that were discussed, speak to your healthcare providers about a referral for a proper risk assessment. Your healthcare provider may be able to give you more information regarding your personal cancer risk, or they may refer you to someone who can discuss the information in more detail. While your initial risk assessment is important, any additional questions or concerns are still important to us. An ongoing relationship is important so that you may communicate any concerns you have or if your family history has changed. There may be new information that your healthcare provider needs to communicate with you. If you would like additional information about anything discussed in this module, please refer to the websites on the UCLA Athena website.